The following is a conversation. It has the features of any conversation, such as imperfectly expressed thoughts, ill-considered opinions, and the notions of several sleep-deprived brains. Try not to get your stethoscope in a twist about it.
Today we're going to talk about what it's like once you're done learning the basics of medicine and it's time for your first clinical rotations. But first, I was in my office yesterday doing my thing, and so I did hear a very angry older male voice from the hallway, clearly pissed off, raised voice, saying something like, "Where have you been? I've been waiting a long time. You're wasting my time, blah, 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 blah." And kind of without thinking, I actually got out of my chair, I went out into the hallway because I was going to defend your honor collectively. I just was like, whatever faculty is abusing this hapless med student, I'm coming to your rescue. Only it was a simulated patient acting super angry, the emotional simulated patient. Do you remember this case?
I remember it very well. I remember when we were getting ready for transitions week and we had these emotionally charged patients come in and interact with us.
All I'm saying is they're good.
It's fun. Yeah. It's still, even
they're
knowing
awesome.
that
really
particular case, and there was 6 or 7 in total.
I imagine it gets your heart going.
Definitely.
Yeah,
Some permissive
they
hypertension.
They got annoyed at me for mine because, I had this patient that was venting about how the doctors aren't telling her anything. And I was just on her side completely, and we were bonding over it. I'm like, yeah, it sounds like they could have done a much better job. And my doctor was like, you don't need to throw all the medical teams under the bus. But I felt for that patient so hard. So I felt like I did a great job. But then I'm like, well, I did kind of trash the hospital.
Yeah, I'm sorry everybody else sucks.
Yeah.
I feel that.
Yeah.
I always had a good middle ground of empathizing with the patient and everything. If it was a real patient, they would have felt heard for the first time in their lives, probably walking out of it.
There we go.
That's probably fair.
Pros and cons to doing
There
it
you
that
go.
way.
Yeah.
That's what these situations are for, right? You help refine that stuff.
That's right.
Meandering in the margins of medicine, it's the Shortcoat Podcast.
Weird news,
fresh views,
helpful clues, and interviews.
by students, for students.
Subscribe to our weekly show at theshortcoat.com.
Welcome back to the Shortcoat Podcast. It's a show that gives you an inside look at medical school from the students drinking from that fire hose. Happens to be a production of the University of Iowa Carver College of Medicine. And I'm Dave Etler. With me today in the SCP studio, M4 Jacob Hanson.
Thanks for having me back, Dave.
M4 Happy Kumar's here.
What up, Dave Dog?
M3 Zay Edgren has joined us.
Hey.
And M3 in pathology extern Tony El-Sokkari is here.
It's great to be here.
Let's go, Tones.
Yay.
Yeah.
Shortcoats, your questions, stories, and observations make this podcast go. Frankly, they're important to me because I need them. I crave them. So head on over to theshortcoat.com/tell us and let us know what you're wondering or thinking about. The more you do that, the less work I have to do to put the show together, and the more it can be about what you want it to be about. So
Yeah.
thanks. Appreciate that. Let's talk about core year. This is what we call the first part of the clinical experience after you're done with your foundational medicine classes, like your didactics. So here, these clerkships are like internal medicine, surgery, OB, peds, family medicine, emergency medicine, and there are a bunch of other short ones here and there, like neurology and
Psychiatry,
anesthesia. M4 Matt Anglican helped me produce today's show, and he sent in this thought about his experience. I want to get your reaction on it.
During my transition into core year, I remember being frustrated about practically everything. I was frustrated at residents and attendings discussing topics way above my knowledge level, expecting me to be able to follow along. I was frustrated that there was so much to do and so much to learn, and I never felt like I knew what I was supposed to be doing. They moved us to a new endeavor before I felt like I grasped my previous skills. I felt like a cog in the machine, and nobody cared about my growth and learning as an individual. And on top of all this, I was frustrated that they made me attend lectures that were never at my learning pace to study for an exam about acute details that I had no chance of learning before sitting for the shelf. Now that I'm a little bit removed from the experience, I think that the main reason I was mad is I just felt so dumb. It felt like I got tossed into the deep end and forced to swim. There are moments that I still deserve to be mad about, but I wish I was able to tell myself that even though it was an awful transition, and even though I still think there's room to grow in medical education, that these growing pains will someday make me a better clinician and teacher.
What do you think?
I think I can talk a little bit about this. For context, I was Matt's roommate during core year.
Yeah.
And so we discussed this at length.
You bonded
throughout the year. Yes. Matt should not be afraid of the deep end. He is 6'6".
Yeah.
But
it's crazy.
Yes. Also, I was a swim teacher, so like if he needed help, he should have just asked.
That's sweet.
But no, it's I know it can feel like a lot, and like we were saying beforehand, is it's a whiplash. The change in direction, I feel like, from preclinicals to like that core year at the 1.5 year mark for us it's pretty sharp. It's a lot.
Yeah,
and
we do this clinical transitions week where they.
Oh, I don't remember that. Besides the angry patient, I couldn't tell you what happened.
Yeah, I feel like it's really just a familiarization a little bit, like, but I'm sure once you get into it, it's like, oh shit, what happened?
I would agree. Yeah, it's like nothing you can really prepare you like the real thing in this instance. So I do think there is a lot of just like trial by fire and just like trying it out. And if you think of it as a sink or swim approach, that's, I guess, one way. Hopefully you swim. But it is pretty different. And I can understand like why so many of us, myself included, were like feeling frustrated at the time. Especially it's like, yes, you're on a rotation for 4 weeks and now all of a sudden you're going from like pregnant people to children, or from like, like there's these pretty like giant swings, and like, all right,
you're
great,
like assuming you figure things out immediately, you're going to your next rotation. And then some rotations have like rotations within them, I think.
Yeah, they do.
Especially like internal medicine, I think.
Oh yeah, internal medicine has a ton, like inpatient, outpatient, specialty, VA, like you're bopping around.
Yeah, so I imagine you don't get a heck of a lot of chance to get comfortable.
Usually that's when you rotate, is once you start to feel a little bit comfortable.
It's right before
when you start to make that transition. Yeah.
There's a lot of little tiny like hospital quirky things you need to know, and phrases that you need to know, and like mannerisms that you need to know. They don't really tell you, and they kind of and like people like week 1 expect you to kind of know what it is, right? So for instance, my very first week on internal medicine, I was actually there with Matt. So I also heard him talk about his experience on his first rotation too. My attending said, "Happy, can you pick up this patient?" I'm like, "Sure." So I picked up the patient and everything. So I saw the patient, saw their initial note in the chart from when they came in the night before and all that stuff, right? A couple days later, my attending's like, "Happy, why didn't you write a note?" And I'm like, "There's already a note from a couple days ago." And they said, "Oh no. You have to write a note on this person every single day,
Happy,
even though nothing is going on with them." And I was like, "What? Nobody like told me that,
Yeah.
It's so silly to look back on it in retrospect, but that was something I just didn't know."
Oh my god! I have a story about something. Go ahead.
Yeah, and like Jacob, you have a similar story too, like your first day on psych.
Let's not talk about that. But my first day on psych, that was my first clerkship. I was like, all right, psych. I hear it's supposed to be pretty like not easy, but it's supposed to be like a little bit more laid back. Mm-hmm. It's not surgery, like say it's not OBGYN or some of these more classically intense ones. And I'm reading like the syllabus or whatever online, and it said, "Hey, come in on Wednesday," because there was like a holiday or something in there. So I'm like, cool. And I was like sitting at home, it's Wednesday, and I'm like getting some of my work done. And I had a question, so I emailed the clerkship director. I emailed her my question, and I was like, just to make sure, I didn't have to come in today, right? And she was like, "You're not in the hospital?" What? And I'm like, oh great, just starting off strong, just like not showing up my first day. Sorry about that.
This is good. You get the all important arc of increasing competence, right?
That's right. Yes, I started low, ended high.
Set your the
luckily,
expectations.
yeah. I pointed. I was asking. I'm like, I'm so sorry. You know, like panicking, little M2 brain, just like, I didn't know any better. Look what it said here, and I sent her like the verbiage that I was reading from. She's like, oh, I can see why that can be confusing, and so like it was all good. It's the nice thing is like we have a flex day for like those rotations.
Oh, sure. So you could make it up.
Well, yeah, it kind of sucked because I was going to use it at the end, and I was forced to take it at the beginning. But you know, everything worked out. Like I ironed out some of the kinks pretty early.
What was your first rotation?
I started on surgery, and basically at some point they give me my patient or whatever. I still don't know what's going on ever. Like everything's like TV static when you're starting out, so you just really don't understand what they're saying. So
the
one
monkey
day,
and symbols
yeah, honestly. So one day I'm following them around. We're doing rounds, and I've got this squad of 8 people that I barely know, and I'm like following them to the elevator, and the attending says to me like, "Hey, Zay, that's your patient, right? Getting the bronchoscopy. Do you want to go watch it?" And I said, "No, I'm good. I just saw one last week." And they looked at me like, "You idiot! Like, what are you doing?" No. And the intern was like, "Zay, you should probably go do it because that's your patient." And I was like, "Oh." And then they're like, "Do you know where that is?" And we just walked down the hallway, but I'm already lost. So I'm like, "No." So she has to come out of the elevator, show me where to go. I watched the bronchoscopy, and then I come back, and they're like, "How'd it go?" And I'm like, I think it was good. I don't think they saw anything. And they're like, "Okay, thanks."
Within normal limits?
Yeah, bro.
Like, I think I guessed the right answer. So I think I ended up winning in that situation.
Nice.
But the whole thing was probably not a W.
You lose track of your residents so much.
Yeah.
Just in Courier in general, but especially at the beginning.
Yeah.
Yeah.
What was your first rotation?
My first rotation was pediatrics, and I started in Des Moines. This is I did my core year in Des Moines.
Yeah, okay.
So that one was pretty good. I started out on outpatient, and I was actually with the dean who like helps run the core year there. For my first day, and
That's awesome.
he was great. It was wonderful.
Okay, so
So luckily, not similar experience, I'd say, on my first rotation.
Yeah. I think the way that you succeed is just finding the helpers, because especially when someone's a resident, and especially if they're in like surgery residency or something, they are so overworked.
Oh, okay.
They like if someone's there and super clueless, it can be really frustrating, and I understand that.
Well, what's interesting about this situation, right, is that so you're on surgery, you're on whatever you said you're on your other like everybody is rotating through at a different point or in a different clerkship.
Yes.
And so your resident is experiencing a range of different experience levels from their students.
Mm-hmm.
Correct. Yeah.
So,
I'm sorry, I didn't mean to interrupt you, but I wanted to clarify that.
Yeah, no, you're good. And I mean, I was just going to say that like you find the helper, and then she explained everything to me that should have been really obvious. She's like, "Okay, number 1, if someone asks you if you want to do something, that means go do it." And I was like, "Oh, okay."
It's a little quasi-military.
Yeah.
If somebody says at your earliest convenience, it means do it.
Right.
Yes.
And then the other thing was like, if you have a question, don't start by asking the attending or like chief resident over here. Start by asking me. And I'm like, "Oh, okay." Ask the friendly person. But it's just some of those simple things. And as people explain them to you, or you experience it enough and fail enough, you finally just start to grasp it and get fluent in the hospital, I guess.
So we're presenting on patients one day during one of my surgical rotations. I'm not gonna say which one. And
seems best.
Yeah. And so I talk about my patient and everything. And the attending looks at me. He asks me a question. He's like, "Okay, what are you looking for if this is like their lab count or whatever?" And I answer. And then he's like, "Great, correct." And so I asked him as a follow-up, "Okay, so whenever I'm checking in on this patient in the morning, what are some signs I should be looking for in order to make sure this person's not actively dying," or something like that. And then later on, I get told by the residents to not ask the attending any questions.
Oh.
which is funny because he asked me a question, and then I was asking him a question to clarify.
A follow-up.
I don't know if I'd say never to ask questions, but that's interesting that they all said that.
Like, bro.
It did feel like a lot of the time in Courier, it's like it feels like you could never win.
Never.
You try, and that's okay. Like I think you're just, you're testing out the waters, and like myself, I didn't really work in a hospital before, like in like a direct patient care type of way.
Mm-hmm.
And so it's like, you don't really know these like interactions. And also it's like you were,
well, how would you know?
Exactly.
Yeah.
And you were listing off all those different clerkships. It's like, I think we do 10 by the time we are done with courier.
Sure.
And it's like, those are very different like specialties. They attract very different personalities typically. And so it's like, yes, it can be very jarring going from one to another and trying to figure that out. And I can certainly see why Matt might be frustrated, as his call was saying.
Yeah.
One other thing I was happy made me think of, and like it was also part of Matt's question, is like attending these like lectures that seems like it's like seemingly not important. And I did feel like there was like a fair number of that. I don't know how like y'all felt. Like there are some like there was. I'll just say it. So like I was on ortho not that long ago, and they made us come in, I don't know, enter early time in the morning here. 6:30 in the morning to like, and I was learning foot and ankle board review material.
Oh.
And I'm like, damn. I know damn well this is not on my exam in a week. Also, I am on sports medicine and I am not going to be like seeing this stuff. So I'm like, yes, I definitely felt this is pretty silly.
I imagine like it just, I imagine that there are times though when you're like, why am I learning this? And then eventually it might come back around where you're like, oh, that's why.
Yeah, I would. So that instance, I haven't had that aha moment where it's like, yes.
Oh, well,
feet
okay, maybe
gonna
not.
be there. Well, for that, but like for others, Tony and I did like internal medicine at the same time. And I definitely remember there was some, like there was like a radiology one. I'm like, I'm not going into radiology. Like, I don't need to know this.
Right.
And then like, no, it was actually like incredibly helpful on my sub. I didn't know how to like read radiographs like a radiologist, but I had at least known like in this case the ABCDE like rule of reading a chest X-ray, and that was like enough for the residents I was working with. So it did seem like, man, this is stupid in the time, but like I do feel like a lot of the times they did have a payoff in the end. Just not with the foot stuff. Yeah.
Well, okay.
Not the foot stuff.
Not the foot stuff.
There's rarely a payoff with foot stuff.
That's what I'm saying, Dave.
I will say that does remind me of some feedback I got from one of my surgical attendings, was that to really try to take advantage of the time you're spending on rotations you might not think you're going into, because like, especially for med students, like that might be the last time you'll see some of these surgeons. Definitely. Or like even if you're not interacting in that space all the time, questions like that might come up in places you don't expect. Like you'll have family members or friends asking about things that, maybe you only saw tangentially in passing in med school, but like, I guess taking in those moments and like some of those lectures that maybe we don't feel might be super applicable to the specific specialty we're going into, I think it's still, there's some value in like trying to absorb some of it.
I've heard this before, where, the question comes up from an attending or a resident or whoever's going to evaluate you, and they're like, so what specialty are you interested in? And then there's a school of thought that's like, I'm going into your specialty no matter what it is because I want a good evaluation.
Yeah. We've heard of that, yes.
I'm not a huge fan of the approach.
I'm not
agree.
either.
I feel like it would be much better to say, well, I'm going, I don't know yet, or I'm going into something else, but I'm really interested in what I can learn from this clerkship that I could maybe apply someday, or at least maybe know about.
Yeah.
And this is the only time I get to see it.
I think they respect you more if you're honest like that.
Yeah, I do too.
Yeah.
There's also the flip side where some people, even though they really want to do that specialty, will lie about it. They're scared to say that they want to do that specialty because they don't want to be held to higher expectations during that clerkship.
Also have seen that, yeah.
I like just straight up told every attending, I'm like, all right, this is what I'm interested in. Most often than not, it was different from the specialty I was in. But I would also, but I walk in each rotation with the same mindset. Best case scenario is I discover I have a passion and a love for a field I never knew I had a passion in, right? And it's like, oh, this is my new number one.
Yeah.
Worst case scenario is I go into this field and I learn something that I can apply to my future patients. Because again, no matter what, it'll apply to your future patients or it'll apply to your family members, right? If you're not interested in OB, you will have a patient who is a woman at some point, most likely, right? If you're not interested in psych, you will have a patient who has depression or anxiety or something at some point.
Yeah.
You know what I mean?
Yeah.
And that goes on with every single specialty.
Just having a little extra perspective on
Exactly.
Yeah. No, I thought it was very nice, like being honest, like when I had an idea, like I came into core year having a couple ideas of like what I wanted to do, but I wanted to go in with an
And
open.
what were those ideas? Do you remember?
It's changed so many times.
I mean, that was what I was getting at. Yeah.
At the time, I thought I wanted to be an ophthalmologist.
Oh.
Very different than feet, the
Yeah.
eyeballs.
Yeah.
And then I just like went
at
in
the other end of the body. If I remember my anatomy.
other end of
Yep,
the
two of
table,
them,
if you
though.
will.
Yeah, yeah.
But I wanted to, and I went in so many things during my core year seemed just cool because I went in with like that open mind. And at one point I was like, I'm going to be an emergency medicine physician, or like I'm going to be a hospitalist. And for even a brief stint, I'm like, kids are cool. I can do peds. And then like, no, truly, like
Yeah.
I thought about all these things pretty seriously at one point or another. But at the end of the day, I like really, I ended up really liking my dermatology rotation. And it was nice when I was kind of done telling people that, because like they know, like when you're done with core year, even though like you might still be in like an M3, like I know a lot of my attendings were like, you're like, I'm gonna think of you as like an M4 because like you're in your advanced year, blah blah blah. I was like, you have done all this stuff, and so they expected like me to know what I'm gonna go into and kind of something about it, blah blah blah. So like when I was doing the remainder of your like 2 week, your little short blocks that we were talking about, I mean, I was like, man, none of this stuff is of interest to me, because it was urology, it was ortho, and it was radiology. But it was actually, there was a lot of interesting things about it. So like for my uro rotation, they have like an end of block like presentation you have to give, but it can be about like whatever you want it to be. And it's like, penis has skin, that's my domain.
There you
I like,
go.
we got it.
Penis do have skin.
Yeah. Or like the radiology one, we had like this patient who had like,
That is definitely, by the way, going into
Great.
a clip for this.
Yeah.
sorry for producer Matt having to hear me scream about penises again, but there was like in the radiology one, like I found it was very interesting because there was like a patient had a like what appeared to be a lung nodule, and there's a whole diagnostic algorithm we have to go in. And I took a second, I was like, wait, I have a question. They're like, yeah, what's up? And I was like, I see all these little irregularities like on the soft tissue around the skin. Does this patient have like neurofibromas? And they're like, yeah, that's actually what we're trying to get. It's like, this isn't a lung process. This is a skin process over the lung that might. So it's like, no, you don't have to sound the alarms and like, oh, cancer until proven otherwise, blah, blah, blah. So it was really nice that they were like, they wanted to hear like what I was interested in, and they could really try their best to kind of connect the dots when
Well, I think that's another
so.
reason to be honest with with when that question comes up of what you're interested in, because if you give them nothing or you give them false information, then it's kind of a garbage in, garbage out situation. I think my guess is that probably a lot of people, at least the good teachers, are going to be like, okay, I'm going to tailor this experience a little bit to what you're interested in. Is that true?
Yeah.
Is that
Yeah, I think especially as you
kinda.
get later on into like M3 year.
Yeah, whenever I told everyone that I was applying ortho, I was in the ICU, and they just gave me every single patient who came in with a fracture or car crash. And I'm like, okay, this is great.
Yeah.
I already have all the numbers of the ortho residents, and I could text them like, okay, this is the patient's ready for the OR and all that stuff. It made it honestly streamlined patient communication and everything too. And because if a patient comes in with a car crash, they have more than just bone fractures. The residents and the attendings use that as a way to teach me about everything else too.
Yeah.
So.
Yeah. It's a way in for them. I think it makes them feel better about it too, just because they now have a direction to go in instead of like, okay, well, this guy's giving me nothing, I'm going to go everywhere.
It's good to get your med student excited about a case.
Yeah.
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 Some buy-in.
So, Tony, you're thinking about PATH, right?
Yeah.
So I was thinking about PATH, and I will say, if you tell them you're thinking about PATH, a lot of people will just straight up roast you.
I was going to ask if anybody tried to convince you that your dream was not your dream. Or that it shouldn't be your
They
dream.
love trying to convince you that your dream's not your dream. I was on with this pulmonologist, and this is when I was thinking between PATH and IM. Now I'm just thinking IM, but back then he says, hey, so what are you thinking about doing? And I said, oh, I'm between PATH and IM. And then He's like, Path and IM, but IM has people and Path doesn't have people. And he looks at me and I'm
people
like,
in Path.
No people, just machines.
Just machines, just microscope. That's it.
Yeah. So I'm like, I mean, yeah, we don't interact with patients like other specialties do, but we do interact with people. And he's like,
there are humans.
Yeah. And he's like, well, why those two specialties? And I'm like, well, I think IM's cool for these reasons. And then I like learning about the information in pathology. And he's like, you like learning about that? And it's 7 a.m., bro. I'm like, I just woke up, man.
You're like,
I'm not ready for this.
Hospital? What?
Yeah.
What's happening?
Well, I think when I hear those things, I'm like, bro, I like this stuff, so you don't have to. Like, calm down. Like, we all have a place in this hospital.
I had a situation, like, I told you guys the story already, but I haven't shared with the podcast yet. I was on family medicine, and, like, a patient came in with some, like, insane brain scan, and as you guys know, neuroanatomy, not my strong suit. That's like where I struggle the most in preclinicals. So like the attending pulls up the scan, is like, okay, I have no idea what's going on. I'm gonna look this up later, but Happy, do you know what's going on right now? Before I text like my neurologist friend, and I look at it, I said, well, FY, I'm applying ortho, so this is out of my realm. And then she stops me and she's like, yeah, no, that makes sense. You can just go home.
And love it.
Not what I was expecting.
Tailoring
you
an
told me that story
experience.
before.
How do you feel like when you're at some point you're going to be a resident and then someday you're going to be an attending, and maybe you'll be working with medical students as an attending, right? Mm-hmm. How do you feel? How do you want to treat? How do you want to treat medical students based on your experiences?
They're gonna have a time.
Baseline, no matter what, boy. Here, baseline, no matter what. I will be buying them food.
Oh yeah,
or coffee.
We're buying them food.
Yeah.
We're cracking jokes.
We are telling them they can go home so they don't have to awkwardly twiddle their thumbs and be like, "Is there anything else I can do to help?" Like, I hated doing that.
Okay, but for the sake of argument, for the sake of argument, I will suggest that maybe your residents felt the same way.
Okay. Yes.
When they were youngsters.
So for people who are out there who are interested in coming here, I think one thing that's really cool is we have like the different distinction tracks, and I'm in the teaching distinction track. And as a part of that, as a third or fourth year, you can take a teaching elective, in which I'm currently in.
Cool.
And I find that extremely helpful because, and when I like sit at the org fair and try to get people involved, I'm like, it's like 90-something% of you are going to come to an academic hospital for like residency. Like, you're going to be teaching med students. When you're an upperclassman or like, in your advanced rotation, like your sub-I or whatever, you will be teaching lower, like the people in core year or whatever. So it's like, you're always going to be a teacher in some capacity. And so I'm like,
not to mention your patients. I mean,
and your patients. Yeah. So it's like, you're always going to be teaching someone in some capacity, whether like you realize you want to, and you're like, no, I'm going into private practice, or no, I want to go into path. Like, you're going to be teaching someone. And so one of the things that's been really nice is like reflecting on like, what are some things that you saw that went really well that your residents or attendings or whatever have done, and kind of thinking about that and then applying that to your own specialty. It's like, oh, that might not work because like different, inpatient versus outpatient, ancillary versus patient care, whatever. And then think about things that didn't go too hot and how you want to not do that.
You can learn from people
so you can
who
learn
don't
a lot.
do it very well. That's
also... So if you had the meanie surgery resident who is like burnt out and like sleep deprived and probably shouldn't be operating on patients, like think about like, I don't know, I like to think about how I can try to avoid that.
I do think about it kind of like, when you hear like the parent stuff. I'm not even a parent, so I don't know what I'm talking about, but I just mean like how people say you learn to like apologize and own up to it the way that they maybe didn't learn to you. So obviously we're going to get upset or we're going to be sleep deprived at some point. So you just learn that when you get to that point, you're going to go to them and you're going to be like, hey, I'm sorry, or I've been a jerk today, or hey, I'm really sleep deprived. I'm not angry at you. Some of those comments I think can go a really long way.
Oh, for sure.
Yeah.
I think like
I think this is like an important human quality. Like if you up, say you did it. Mm-hmm. Just don't try to pretend like it didn't happen.
I think also like on the flip side, like there are like I met some wonderful mentors here, and honestly, like all it takes is like one really really good mentor for you to have a wonderful time on your rotation, and like maybe even apply and try to go into that field. Honestly,
yeah. Going back to kind of what Zay said, I think like it's especially helpful when they're honest about like circumstances that are affecting them that day, because as a student that's going in every 2 weeks, it's hard to get to know some of these people.
Yeah, you don't know what they're like.
You don't know what they're like. You don't know their personalities, and like I think that can really leave an impression on you if you think, oh, my performance was subpar, or like I'm really not doing well as a student, versus oh, there are these very specific situations that happened on this day that led to why this interaction went weird or awkward or like uncomfortable. And sometimes it's hard as a student, especially when you're there for only like 2 weeks or something, to like know that.
Well, what about evaluations? So you guys get evaluated all the time on your clinical rotation. Tell me something about that experience. What do you do with that information?
There's a lot of learning to be done with that.
So
because I read during your
you read our misbees.
I read a lot of your evaluations as we create the medical student performance evaluations, which go to your all that kind of stuff. And and Audra does too. I feel like we see a lot of evaluations that were like, I don't know if that's the way I would have evaluated a student. Or
I think with a lot of evaluations, you have to look at it through a lens, right? So none of these evaluations are objective. They are subjective through the eyes of whoever's giving you that eval. And that's just kind of how I view a lot of them, which is like, because it's through that person's lens, they might not have been having a good day. They might not be the best judge of character. They might not be around to see whatever you did.
That's the thing. It's like, it's weird when it's like someone that you've worked with for like 30 minutes a day or something, because it's like you're more with the residents or whatever.
So so whenever I got like an eval that like did not go well, like my very, very first eval from that attending who was like, why didn't you write any of these notes? Whenever like I did write all the notes, my eval actually stated that like all my notes, even on the days when I wrote them, were late, which is very strange because I would get them in at like 9 or 10 a.m. and the deadline is like 5 p.m. right? And so whenever I looked at that, I'm like, I'm not going to take this eval too seriously. But like I do see like some of the frustrations that this attending has with me, which is like, my organization skills and everything, right? Maybe I can brush up my organization skills and be a better med student, even though this is like my first week of core year.
Yeah.
If that makes sense.
It gave you something to go off of, like how to improve. It may not have been exactly accurate, but
it's like it might point me in a direction if I think that it's a useful eval. Some evals are just singing your praises and you're like, there's nothing much I can get from here. And some evals come from people who hate you. And then it's just like, okay,
jaded person out there.
Like I can't do anything with this. But some of them have like a couple kernels you could use to kind of go in the direction you want to.
Yeah, and going off of what you're saying, I think that 99% of the time it's not possible to learn something new from an eval. What you learn from is what they tell you in person, experience you have, and then ideally the eval reflects that or re-emphasizes something, reminds you later, and you're like, yes, okay, just like we discussed.
Yeah.
So if they're teaching you something new or blindsiding you and then writing like evil things in there, then you're not really learning from it. Or like if they're just praising you, like, oh my God, they're the best med student I've ever had. Like that's kind of nice, actually. I like when they do that.
You got to hear that once in a while.
Yeah.
You don't hear it enough, so it is nice to hear.
But it's not teaching something new.
Getting blindsided is the worst.
Yeah. So that's what a question that I wanted to pose to the group is like, did you feel like you got enough feedback during your rotation?
I feel like sometimes, especially those like mid-clerkship feedback sessions, it seemed like it was more just run for the like.
Oh, that is just like
getting the
bureaucracy checking boxes.
But I do think that this is something I did, I guess, more recently before I started the path year on my Mickey rotation was, I think if you ask individually in the right context, like one-on-one with an attending, I think that's a really good opportunity to get like some like real feedback, and especially if you press them on like things that even if it's not like that big of a glaring issue, like how can I be better for tomorrow, or like what's something different I could consider trying.
Absolutely. So that's like kind of what I was like. One of the things we've been talking about in class is that or something that I've been gravitating towards is there's a difference between feedback and evaluation. And I think that one thing that I don't always realize in the moment is like I might be receiving feedback. And so like going back to like what I want to do to be a good resident is like if I'm sitting down with a student or a trainee or whoever, I want to maybe signpost, use our little words that we like to use, and like just let them know it's like
feedback.
Yes, I mean it doesn't have to. You don't have to make me sound like a robot, but it's like, you know, I want them to like know that it's like, hey, this is like not like a formal evaluation of you. This is not going to go into your grade. This is something that might help because you're interested in this thing, because we like took the 30 seconds to talk about what your future career is going to be, and like try to guide them in that right direction, so it's like they can get the most out of the rotation and they don't feel like they're just like, this is dumb, blah blah blah. And then when it comes time for the evaluation, we can talk about things that they did well. It's like, I know that Tony really wanted to come in and do this thing, you know, and
let's go Tony.
He did it, like it showed that he had initiative and he blah blah blah, and he did a good job about it. And then this is how it, like, keep on like making like goals for yourself, because I think that's one thing that's like really hard for us to do, especially in core year. I felt a little bit more comfortable like during the advanced stuff, but it's like you just go in, you're just like going through the motions, going through the flow or whatever, but it's like, no, I really want to do this thing, I really want to see this, I really want to do that. And I think that it's challenging for like the students, especially, you know, near the bottom of the totem pole, to like speak up and be like, no, I really want to see that bronchoscopy if you feel so inclined to, or like,
I think people dig that. I think
that shows a lot, and that can be something that's actually useful in your evaluation.
Never underestimate the power of asking somebody to specifically asking somebody to talk about their specialty or their their situation, because it's a good signal to them that, you know, you're paying attention. And, you know, let's face it, people like to talk about themselves.
A lot of med students actually have issues with asking for feedback. I was on one of my away rotations for like orthopedics, and whenever I asked for feedback like a couple of times, like the clerkship director over there told me like, oh, like, you know, like you're like an average like ortho, like, you know, sub-I over here, which to me, like, average is pretty good. That means you're doing great over here. But something that you excel at is asking for feedback at the end of a clinic day, or at the end of a surgery day, or at the end of a week. And not a lot of med students know how to do it, and not a lot of them know how to do it well. So
how do you do it well?
So it's a skill, I think, honestly, too. I think like just a couple of things are knowing to ask it at like the right time.
That's huge, yeah.
Yeah, don't do it like in the OR, or like right, like whenever like shit's about to go down. Don't do it whenever you're behind 2 hours in clinic.
Yes.
Do it whenever there's kind of like a natural resting time. Whenever it's like, okay, we're done with all the cases for the day. Or
lunch is a good time, I found.
Yeah, lunch. I honestly like to open up a lot of like, hi, my name is Happy, yada yada yada, I'm here for X amount of time. Just asking, what are your expectations for me today in the OR and in clinic, and they give me those expectations. And then maybe during lunchtime I'll be like, okay, how was I in the morning? Like, did you like it when I did X? Did you like it when I did Y and Z? Anything I could like improve on? And then we go on, and then and then we chat, and then like I wait like a little bit of time after, because you don't want to do it too frequently.
I'll add something. Go ahead.
Yeah, and one brief thing is if they give you a piece of feedback and they're like, hey, you could work on this, you should like work on it. And next time, whenever, yeah, right. But next time, like whenever you ask for feedback, you're like, hey, I remember from last time you told me to work on my presentations. How have my presentations been since then? Because it shows that you've been thinking, you've been trying to incorporate that feedback in.
Definitely.
Yeah. So, yeah, those are all really good points.
Yeah.
One thing that I would add is that anytime you ask someone for feedback, it should be somewhat specific, because you have to show them that you're well versed enough, that you like know what's going on, you have some self-awareness.
Yeah.
One of a lot of attending's pet peeve is when a student keeps coming and asking them like, hey, what can I improve on? And then the attending has to do this mental gymnastics where they figure out like all the things that you've done and who is this person and what are they like and like which things should I give feedback on and how much time do I have, versus if you're like, hey, one thing I've been trying to work on is my like note taking or my presentation. This aspect of it sticks out to me. What are your thoughts? And then they'll be able to answer it, and then they're more likely to give you more of their thoughts because you sort of jump started them.
Yeah. And even then, along with it, if you give them like an open-ended question, it's like, hey, anything I could help out with? A lot of people are like, like they have to scramble and think about it.
Yeah.
Oftentimes they're overwhelmed.
Yeah.
Whereas something I thought that was helpful in my sub-eyes is, hey, can I write this note for you? Hey, can I go and like, bird dog this OR for you and get the patient ready? And just having that little suggestion in there just kind of takes a little bit of the mental load off them and makes it easier.
Yeah, a big thing that I feel like that they look for is like, do you have the awareness to see what needs to be done still for the patient?
Yep.
And do you have the initiative to volunteer to help out in the ways that are like appropriate for your learning level?
Yeah, like they think you're so awesome if you start with the whole patient list and then you jot notes as they're doing the like sign out or sign in and whatever.
Yes.
And you're just like, oh yeah, can I call that clinic and get that information? They're like, whoa. You remember
Heck
that?
yeah, you can.
Oh my god.
Go for it, Zay.
I got
and watch that bronchoscopy.
I got so much positive feedback by like if there was like outside records that needed to be faxed in from some random clinic, I would just like I would just Google the clinic, I would call them. Sometimes you'd be on hold for 10 minutes, but again, yeah, sure, you're going to be sitting there for 10 minutes, but the resident's going to see, oh my gosh, this guy just saved me 10 minutes of time.
Yeah, that's huge for them.
Oh, big time.
Do you feel though like, okay, so how do you, let's see, how am I going to put this? How do you figure out, how do you decide what's busy work and what's actually helpful? Because I know busy work is a huge complaint for med students.
It depends, right? If this is a field that you want to go into, right? Like if it's like your sub-I and if you're trying to go into a competitive field, if you're on an away rotation, then you're going to do that busy work because you're going to want to make a good like impact on people, right? If it's like a field that, you're not really too much interested in, it's after core year, you're M4, you're just finishing up a requirement, then you just let other people do it, unfortunately.
What's the
I don't know about that because as I was talking about earlier with those like silly little 2-weekers that we still have to do, it's like I would spend a lot of time in the OR and like my surgery is very short, very sweet. Now like general anesthesia, blah, blah, blah. But it's like I knew how to like help break the bed down. And I knew like where the like blanket warmer was, or like, oh, the patient's waking up, grab the bed from the hallway, things like that. And it's like, I think that little stuff just like helps so much. And it's like, that is something that I feel like they recognize because I thought it was so funny. Some of my best evals were from the rotations that I didn't think I like was like very like trying to impress them. So like during these like little 2-weekers, I'm just like doing what I thought was just like super, like almost automatic, just like, yep, all right, let me go grab the bed now. And they were like, great med student, 10 out of 10. Like, oh my gosh, what was this during like core year when I was just like, trying my best to like call in for outside records or whatever. It's just like, I think we just like pick up on these little things that like residents do that's like
that sort of improve the flow of how things are going to go.
They do. The one that has the most like free time to like help out with some of those
we do.
things.
Like we have like maybe 2 notes to write for if you're like on your sub-I versus like the resident might have like 10. We have a little bit more bandwidth.
What's the busy work? I don't know what busy work is in clinic. I've never heard that term used.
You don't really see much in clinic.
Yeah, clinic's a little
different. No, any time in the hospital. I just don't know what you guys are talking about.
Like you said, like getting records, I feel like might be like busy work. Updating the family.
They call that busy work?
I think it depends on the student. Like if the
I guess it's a frame.
I've never heard that. I'm just kind of confused.
That's a fair point. Yeah,
I think that's all just the work of the hospital. I don't know.
Yeah, so here's how I would like describe it. It's either work that you can learn from and like read up on patients, like come up with diagnosis, look up treatment plans that'll help you out with your learning, versus go downstairs and fetch us 3 pieces of lead, which you're not going to learn anything from that. You're just taking 10 minutes and it's like
maybe busy works, maybe scut work is more like it's the things that's like you have the skills to do, but other people don't want to do it. I think getting the lead is like a good one. Yeah.
Okay, I see what you're saying. Like being their lapdog. Or...
Yeah. Well.
Yeah.
I don't know what that.
I don't even. Wait, am I using that term wrong? I don't even know what lapdog is. I thought that's like when you're like kissing up and like doing all that.
No.
I wouldn't say kissing up. You're just like helping out. The flow.
And like a lot of these things like really, really do help out, even though they might seem trivial. Like again, like as Jacob was saying, if you're pulling the bed into the room after like the surgery's done, the patient gets out of the room faster. Next patient comes in quicker. Yeah. Boom, you're out of the hospital earlier.
Yeah, and your resident can type up their note while like because that
it's a win-win.
Yeah, it's a win-win. I think, and it's like I have the skills to grab bed, open door, lock bed next to patient bed. Like,
hey man, those are good skills.
Yeah, they're good.
Man. And like you don't learn this until you've like been in the hospital.
Yeah, there's a little trial in there, I would say.
Also,
Did you need to leave?
I think I do have to head out. Yeah.
All right,
bye, Tony.
Thanks for coming.
Yeah, we're glad to have
Tony.
you. Okay, so, well, actually, I'll let Tony escape from his little prison there.
Great escape.
See
you, Tony. I wanted to. So now that you did your core year.
Yeah.
You guys especially have sort of progressed well into the advanced clerkships. In fact, you're looking for work.
You could say, yeah.
How so? And interviews have basically come to an end for both of you guys, right?
Yeah.
For us, I know there's a couple classmates of ours out there that have like one or two. They're mostly done.
Yeah. How has the interview process been?
Chill.
I think it depends on the interview. I don't know. It's a little all over the place.
All right. So you're gonna fit into one or two camps, Dave. All right. You're either gonna have a lot of free time and not have to prep for a lot of interviews, which means you're not doing much, and you're going on vacation, you're playing video games. It's a great time, but you're also freaking out about not having a lot of interviews.
Yeah.
And then the other camp.
That's true. Yeah.
And then the other camp is you have a bunch of interviews and you're exhausted from either having to travel or having to prep interviews or going to socials and putting on like your best social face,
and smiling for 2 hours,
and smiling for 2 straight hours, and researching each individual program that you might have just randomly sent an application to that decided to interview you. And you're exhausted.
Yeah.
I would say that asking an M4 how interviews are going is like asking a woman her age.
Oh.
Yeah, honestly.
Because
how dare you, Dave?
I feel like sometimes it's kind of faux pas. Sometimes it's good.
I'm not asking how your interviews. I don't think I'm asking you how your interviews went, like how you feel about how well you did in your interviews.
Well, it's like the way you ask it, I guess, can change how it goes.
I should have.
But sometimes it can be interpreted in like a way.
With your friends, it's really nice because there's like, at least with like the people that I know that are like going into my specialty, it's been really actually rewarding, like chatting with them and like seeing how they're going and like comparing programs and what have you not. I know that some people get very taboo and close off when talking about it, but at least here I feel like it is nerve-wracking.
Sometimes don't want to talk about it.
Yeah, but I mean for me they seem to be, they're kind of fun at times. I feel like, especially like if it's like your home program or if like if you did in a way, it's kind of fun because it's like chatting with old friends. I feel like for the most part they're just excited to see you. Like
you guys know each other.
You know each other. It's like we have like one, like at least for like the interviews that I went to, it's like we have like one like standardized like question to get like an objective measure, and then the rest is just like talking about my dog or like whatever maybe you want to talk about.
Some piece of your application that they were like, oh, I relate to that.
Yes, and I was going to say, I feel like the thing I get asked about the most of my application by far is my hobbies section.
Yeah.
I think that it's like, oh, cool, you were the leader of your interest group, or like you did research. Okay, that's cool and all, but this thing, you're whatever.
Why do you think that's important to them?
I think that
because it does. I mean, at a first glance, it does seem very, sort of tangential to the.
Well, I think the point of the application of like your ERES or whatever the other ones are, it's like, are you going to be a good enter here hospitalist, dermatologist, orthopedic surgeon, anesthesiologist, whatever, and then like the interview is more, are you a good fit for our program? And it's more like, would you would you not suck to come to work every day for 3, 5, 7, however many years?
Yeah, I think it's super program dependent, whether they're academic or community. Academic might grow you more on research, community might be more of a fit. Jacob, I think you're kind of in a weird position because you're applying derm, so everyone who's coming in is going to be smart. They're all going to have good LORs. They're all going to be hard workers, right?
You're applying ortho.
Yeah, I know.
It's the same thing.
Yeah, I know, right? So like you don't get a lot of so it's like all that's assumed. You don't have to prove that this person's smart, but it's like on ortho side, it's hey, is this someone who if I'm like I would want to operate and not be annoyed with at 2 a.m. You know what I mean?
Yeah. Maybe it's no specialty where they need you to prove that. Like you know.
No,
what I mean?
think it's for most specialties. It's like are you a cool hang basically?
Okay.
I think that's they're trying to feel like that out.
Yeah, ortho does. They go really hard with that stuff. Like they go so hard with finding out if you're a cool hang based on happy stories about interviews. You just tell like 1 or 2 stories. Just give everyone a picture.
Okay. Questions. Okay, so on one of my away rotations, we had to do.
Keep in mind, you have not been hired yet. So.
Yeah.
So proceed with caution.
Yeah, I'm gonna be pretty vague.
Zay, you're gonna
That's
be in our
you
shoes
don't have
one
to
day.
tell these stories. Editor can cut this out. We don't have to go into this.
We
can stop.
So on one of my away rotations, we had to do a presentation at the end, which for a lot of programs, it's like a pretty academic. Like, oh, here's a case that I saw. Here's like a cool patient or whatever. Mm-hmm. On one of my ortho aways, I did a 10-minute PowerPoint presentation. I ranked all of the Fast and the Furious movies, and I gave them their pros and cons.
Love that. I think that's so fun.
At one of the interviews, I got asked what my favorite conspiracy theory was, and to explain why.
What was your favorite conspiracy?
Oh, by far.
Don't get them started.
Easily the flat Earth theory. All right.
Okay.
So all these conspiracy theories, right? Like for instance, like the government lizard people one, all right? You can give someone who believes that, oh, here's the evidence that that the government's full of lizard people. They're just going to move the goalpost. They'll be like, oh, that photo? Yeah, it's photoshopped or whatever, right? But the flat Earth people, all right, they're actually trying to do science. They're actively trying to conduct experiments and trying to prove that the Earth is flat. And they keep on failing at it. They keep on proving that it's a round Earth. I saw a Netflix documentary on this. It's called Behind the Curve. Highly recommend, right? So you see these people are trying to do actual science, right? Whereas everyone else isn't actually actively doing that. And I find that to be a lot more fun and easier to laugh at.
So they're making the effort. They're putting in the work.
Exactly.
Yeah. Okay. Were there any other? Did you guys have icebreakers for when you did resident meet and greets? And you're doing all this virtually.
Yeah. Oh my God, the virtual aspect of it, I'm so over.
Oh no, some of these are in person still.
Oh, okay, yeah. So some of the more like procedurally based specialties do stuff in person. All of my interviews were virtual, which is like it's nice because it saves a ton of money and like time and whatnot. Especially so here we get like 8 weeks off to like do interviews and whatnot. My specialty's release dates aren't even until the very end of that. So I was actually taking classes and doing rotations during that time. So I was like, man, I'm like so ready. I think it's like really hard because it's like you can tell a lot of these residents are also like coming in like after like a day of clinic or what like in the hospital, and they're like kind of over it too, and they're just like, all right, you guys want to do 2 truths and a lie? Okay, great. Like well, one thing that I did really appreciate is one of them, it was a chief resident. He had read all of our hobby sections, and so he was just like, "Tell me more about this. Tell me more about that." And again, that's going like I feel like the hobby section is like there's so much weight. Like they love asking about that. So I think that's kind of interesting.
Did any of you put the Short Code podcast on your application?
I put down Frolics.
That's not the Short Code podcast.
You could combine it, right? Like the entertainment industry and then parentheses Frolics.
I think it's like 300 characters or something. It's pretty. It's short.
I just want to say that's rude.
Wait, have you guys been on more? I don't know how often you guys go on.
I think that
I've been on at least one.
You've been on more than that.
Been on more than one.
Yeah, it's at least one.
You know, this is our 4th year here. Like we've been around for a second.
You guys were, I don't know about, I don't think Zay was what I would call a heavy hitter, but you were on a few.
I did at least 2, if I'm including this one.
And I know Jacob.
4 or 5.
Yeah, and Happy's
3,
been on
Glockenflecken.
Yeah, I was going to say we're on Glockenflecken.
And then I did the AKK one, and then this one, 3.
Well, okay, fine. I guess I
I'll put it on there since you said
Yeah,
that.
Zay has time.
'Cause I haven't applied yet.
Okay. Well, only put it on there if you want to talk about it. Remember?
Oh, that's true. You have like anything's fair game.
Yeah,
on the app. So, and one I think it's also sorry to harp about this. I think it's nice, especially certain specialties. You need to do like a preliminary or transition year before you go into like your advanced stuff. And so like I did a lot of prelim interviews, and it's like either like IM people or like PM&R or like radiology or just like things that aren't derm. And so they're like, I'm not going to ask you about melanoma, but you have a dog. Let's talk about that. Like, it's really nice that they like that's something that they can grasp, get their teeth in and get excited about.
I expect that it's sort of the situation like you're graduating from a medical school that is accredited. They're all accredited the same way. I think we can. And I've got your scores and I've got your grades. I think we can sort of assume that you're going to be competent. Let's talk about
something.
Let's talk about what kind
Let's
of a
talk
human
about
you are.
the Fast and Furious movies and Flat Earth.
Happy. I was going to tell you my favorite conspiracy theory.
Yeah, what is it?
It's that chocolate milk comes from brown cows.
Of course.
Is that a conspiracy, or is that just like a childhood?
Or is it just a fact?
Or is it just?
see again, like someone who like believes that will see a picture of chocolate milk being made or a video. Be like, oh no, that's photoshopped.
Yeah.
That was just like Chat GPT, like with the video or whatever.
Big Milk wants you to think.
Big
exactly.
Milk.
There's no fun in that.
Zay, you're allergic to milk. Why are you thinking so much about it?
That's why I have the conspiracy.
No, you're like, I can't enjoy it. I have to enjoy
like
a different aspect of the milk.
Dark part of my mind that I don't get to explore because I can't consume milk. So
the
I make
milk part is your
conspiracies
mind?
about it. The part of your brain that processes milk.
Huh? Dude,
Milk's processed in my gut.
Dude, I love dairy. Just throwing that out there. It's great.
I cooked with a lot of cheese this morning, so stay away from me, Zay.
Yeah, just your energy is like radiating towards me now.
Yeah.
Zay's
like, I regret inviting these M4s fourth years here.
I have a future dermatologist on the show today, so I wanted to talk about this case study that I ran across this week that you probably did too. This is from the I Didn't Know That Could Happen desk. This report from JAMA Cardiology.
Whoa, that's cardiology.
One of the difficulties your patients face when changing their diet, hopefully for the better, is the sacrifices that they make to be healthier, right?
Sure.
One such patient made that kind of sacrifice, and I'm not sure at this point what exactly the sacrifice was. The patient, a man in his 40s, began a carnivore diet about 8 months prior to presentation. Okay. So this includes, I think this is daily, 6 to 8 pounds of cheese, sticks of butter, and extra fat added to daily hamburgers.
Does he poop?
Is this Ron Swanson?
Yeah. And he
Liver King? Like what?
He said that he was pretty happy with his weight loss. He had increased energy and improved mental clarity.
No,
I have GERD thinking about this.
Pounds of cheese every
Seems
day.
very subjective. Like a placebo.
Well, I guess if he was eating 12 pounds of cheese, this is, harm reduction.
But he was experiencing a complication.
I can believe that.
I mean, 1 pound of cheese, that could be like, what, 500, 1,000 calories?
Oh, probably more than that.
Dude, I'm just thinking about this movie that I saw where a guy would eat 5 dozen eggs a day, and he was like built like a barge. It was insane.
Well, what do you suppose was his chief complaint?
I was going to say constipation, but now I'm confused.
It sounds like he might get the
diarrhea.
Yeah.
Mm-hmm. Mm-hmm.
Well, I guess for you, it
seems
anaphylaxis. I don't know.
Yeah, anaphylaxis. Yeah,
seem reasonable. This was the presentation.
Yes, please.
Oh, it's a picture.
Oh, that looks yummy. Is it like some xanthoma?
Xanthelasma.
I see some yellowish bumps on bilateral palm.
Cheese
palmar
hands.
yellow deposits. Looks like a magnified view of it.
I would call this cheese hands. Yeah.
Yes, the ICD code for cheese hands.
So his cholesterol exceeded 1,000 milligrams per dl. It looks like fat is literally oozing out of his palms, and apparently it's also his elbows.
Oh my goodness.
I think more. So
Tophaceous gout is like thinking.
So I looked it up, and usually like this happens around the eyes. I think is the classical.
That's the USMLE like.
Yeah. Like so I guess But it looks like there's actual cheese like coming out of his hand. But I don't think
cheddar fan right there.
I don't think he's actually like. I don't think it's actually coming out of his skin. I think it's like depositing underneath.
That's my understanding. Yeah.
Right? I saw this and I was like, is it coming out? Is it oozing out? And what does his dry cleaning bill look like?
Yeah, honestly. Oh my goodness.
Yeah, I don't think it oozes out, but I wonder if you cut open the skin at one of the little deposits, like would a little white clump come out? Would a cheesy clump come out?
It would just be like a bunch of fat deposits.
I cut his hand on a rock and then the cheese comes out.
Yeah, so for our listeners, do not eat 6 to 8 pounds of cheese a day.
I think it's unwise.
I guess we can't make blanket statements.
None of us have
probably not a great idea.
None of us have MDs yet.
That's true. I have.
Yeah, we make no medical recommendations on this show.
That's right.
But I don't think I could eat 6 to 8 pounds of cheese. I don't think there's any circumstance. I even get sick of like cheddar after a couple of slices.
Most I've eaten is a pound of shredded cheese at once.
That's pretty impressive.
Yeah.
Did your hands look like that when you were done?
No.
Okay.
Teeth look like that.
Yeah.
Dude, I just love shredded cheese, man. Just like.
Are you like the shredded cheese fridge gremlin where you're like?
Yeah. Yeah.
We've all been there in a desperate moment. Yeah, it's fine.
Yeah, that was me during my gap year.
Okay. Well, that's our show. Zay, Happy, Jacob, and Tony, who left. Thanks for being a part of it.
See you, Dave. The best flavor, by the way, is a sharp cheddar. You can get it at Walmart. They have like a 1 pound bag. If you get tired of that, get like the Mexican 4 cheese blend. That's maybe like a 2.5 pound bag. Get these at Walmart.
No, Maddie and I, we just bought this sharp smoked cheddar from Hy-Vee. Mm-hmm. It's some Australian brand. It's very good. Because we're M4s, we're doing M4 shit. So I've been baking a lot of bread. Oh. Homemade grilled cheese with that.
Yeah.
We ate the loaf in 2 days.
Nice.
It was delicious. A lot of grilled cheeses.
Well, there's your recommendations for your shopping recommendations, listeners.
Yeah, that's right.
Thanks also to Matt Engelken for producing this episode. And what kind of oozing lump of subcutaneous cholesterol would I be if I didn't thank you, Shortcoats, for making us a part of your week? If you're new here and you like what you heard today, follow the show wherever fine podcasts are available, like Spotify, Apple Podcasts, Google Podcasts, YouTube. The show is made possible by a generous donation by Carver College of Medicine Student Government and ongoing support from the Writing and Humanities program. Our music is by Dr. Vox and Catmosphere. I'm Dave Etler saying, don't let the bastards get you down. Don't do it. Talk to you in 1 week.
I think that's more of a dermal, not subcutaneous process, but we'll let it slide.
I was going to say, I like the ad-lib.
Hi, Shortcoats. Look, life in medical education, life in America, life in the world is often difficult. And I often wish I could help. All I have is this podcast, but in my wildest dreams, you have the support you need to lead a life of your choosing. You deserve to be happy, healthy, and successful in whatever ways you define those words. So if you need support because you've experienced racism, discrimination, harassment, mental health crises, I want you to be able to get the help that you need. And so I'm going to put some links in the show notes to some resources that you can use